Who knew it was possible to straighten teeth without braces? Who knew tongue placement correlated back to different aspects of your health, breathing, and immunity? Well, in today's episode, we're talking about Myobrace, an alternative to orthodontics that gets to the core and root of the problem when it comes to crooked teeth, sleep apnea, mouth breathing, and more. Myobrace improves the development of the face and jaw. It reduces the need for orthodontic work, straightens teeth without risk of relapse, improves tongue and lip positions, and can even correlate with your health and issues that you never expected, like asthma, bedwetting, hypertension, and more. Dr. Chris Norton practices general dentistry and orthodontics. He lectures internationally and has been implementing Myobrace for over 10 years now. He refers to himself as the airway dentist and treats his patients with the least invasive approach, no extractions, and looks to correct the cause of an issue rather than simply the aesthetic symptoms. This is a great alternative for children at 3.5 on up, so be sure to share this episode with a mom of a little one. Hey, it's Autumn McLeese, your birth doula and Crunchy Mama source for choosing healthier, alternative ways of living. Because when you know better, you do better. Join me as we explore topics that might challenge what you know to be true when it comes to health, birth, and beyond. Let me help you think outside the box and empower you with steps to do better. Your best life could be on the other side of this next podcast, so join me now. Hey friends, so today we're going to dive into a really awesome and interesting topic. This is something that I just recently learned about, and I am blown away at how I didn't know about this, first of all. And second of all, it's like an alternative to braces, if you could even call it that. But I am thrilled to have Dr. Norton on with us. We're going to be talking about Myobrace and myofunctional therapy. Dr. Norton, thanks so much for being here.
Thank you. It's good to be here.
So let's hear a little bit. Well, first of all, okay, we have so much to cover. What is Myobrace or myofunctional therapy? And then I'm curious, why did you choose this path instead of the traditional, orthodontic route?
Okay. Myofunctional therapy was actually started by a California orthodontist in the 50s, so local to your area. Um, and he found that doing traditional orthodontics was always relapsing. And so oral myofunctional therapy was a desire to get at the cause of the problem. He found that just doing braces was a mechanical solution, but his patient was biologic. It wasn't a robot. So, oral myofunctional therapy is a way to try to reverse the ills that we see. If we go back 250 years and we look at all the skulls, there are less than 1% of the skulls have bad bites or malocclusions. Um, so something about 250 years ago started our teeth or our mouth to decline in size
Wow.
and shape. And we go back, what's happened 250 years ago? And our thesis is one, baby bottles were invented and pacifiers were invented 250 years ago. The Industrial Revolution happened 250 years ago, so our air to breathe is nastier, and processed food was invented 250 years ago. So
Hmm.
we started to see this malocclusion spread in the areas that had those three factors going on for it. Today, the only place we can really find children with very, very good mouths are kind of in untouched people groups that don't have any of these three factors going for it, or very, very poor regions of the world that can afford those the processed food uh, and baby bottles and pacifiers and stuff like that. So oral myofunctional therapy was designed to retreat the muscles to get them back going where they're supposed to go, that we should have learned in breastfeeding. So when we're breastfeeding, we're able to learn how to swallow the correct way and breathe through our nose at the same time. So at breastfeeding, you'll see that the child is on the breast and taking milk in, and also sucking air in through the nose. So they're nasal breathing and swallowing the correct way. You put somebody on a baby bottle, and the tongue is in a different position. We learn different muscles to swallow with, and we do a lot of mouth breathing. So to overcome uh, this disease of industrialization, we got to kind of retrain the muscles uh, that we should have uh, learned to use when we were breastfeeding. So that's oral
Well,
myofunctional therapy. Sorry, long answer. Then then the other question was what is Myobrace?
well, why did you
Or
choose myofunctional therapy as opposed to
okay,
just traditional orthodontics?
okay. I started down the road of traditional orthodontics, and I would have stayed on that road, except that God has a very big smile. He put my son in place, who is what I call class three. His total upper jaw was totally in an underbite situation. And so I searched all over traditional orthodontics to find a solution for him. If I didn't have that child, I probably wouldn't have questioned anything. Uh, so to be able to find out how to treat him and not do it with jaw surgery when he's 25, I had to take kind of a convoluted path. And with that, I found the way to treat bad bites, which is what orthodontics corrects, can be done by treating it traditional orthodontics, which is just treating the problems or the side effects, or treating the cause of the problem, which is oral myofunctional therapy. So
Mm.
I use oral myofunctional therapy because I'm treating the cause of the problem. And in the meantime, I got my son. He's never had surgery. Um, he has a class one or good bite, and he doesn't wear retainers.
Wow, that's incredible. And so, and that's fascinating that you say he doesn't wear retainers because I think we're all familiar with the traditional orthodontic route of like, I mean, you wear retainers for years, or if you don't, I mean, your teeth move. And that's basically going back to what you were just saying is we got to fix the root of the problem.
Right.
And it's so admirable of you too to stop and look at what is out there for your son. And I mean, obviously orthodontics wasn't cutting it, but just the fact that you were researching really says a lot about you, because not everybody does that. They just kind of go with the flow and whatever we're used to in this world. So that's really awesome. I feel like this was meant to be because you are an incredible dentist. And would you call yourself an orthodontist? Like what is your official or myofunctional therapist?
I can't officially call myself an orthodontist because I haven't had the 2 years of training to call myself that. I'm just a general dentist that performs orthodontics. Uh, but I like the term airway orthodontics.
Airway orthodontics. I love that. Well, before we move into like all the airway and, health stuff, which is really mind-blowing, what I just want to help everyone understand listening, like how do you utilize braces in myofunctional therapy, or Myobrace, as I think the company is called? How do you utilize braces compared to orthodontics? Like, what are those differences?
Okay. Braces are very, very good at correcting what I call soft tissue dysfunction. So if we go back to the muscles again, uh, teeth live in between where the tongue pushes them out and the lips and cheeks pull them back. If your tongue's in the right position, the teeth will erupt over the tongue, hit the cheeks, and come into the correct position. If the tongue's in the incorrect position, the teeth will erupt almost anywhere. And so braces are very, very good of correcting soft tissue dysfunction. Uh, the problems of soft tissue dysfunction, but they don't correct soft tissue dysfunction itself. So I use braces to repair, but I use my soft tissue dysfunction program, my Myobrace program, to get rid of the problem that caused it in the first place. So
Hmm.
I use braces. It depends on what age what I use them for, but mostly I'm trying to make the upper jaw big enough to receive the tongue, and that's what I want out of my braces. Now, some people want more than that, and that's fine. I can do more braces and make them look perfect, but I can also teach the person to swallow right, breathe the right way, and then they can have straight teeth the rest of their life without having to wear retainers the rest of their life because we've corrected the cause of the problem. If I just do braces, not correct the cause of the problem, then we have to bring in another mechanical thing called a retainer to try to keep the smile in there. And there's been research that between 88 and 92% of the bites will relapse even with retainers. So,
Mm.
so again, it's a whole different philosophy. Uh,
Right.
so that's
So
why
you're
I use
kind of
braces.
so you're using braces um, just as needed. So you're implying maybe
Correct.
some children might not even need them and others may need them for a short amount of time.
Yes, if I can get a child before 8 years old, and we can correct the soft tissue dysfunction, the poor swallow, the poor breathing, then a lot of times they can have the capacity to grow on their own and recover from what they've from all the bad habits they picked up from age 1 year olds on. Uh, After 8 and about age 9, I usually have to do some type of correction using an expander and braces. I've got to make room for the tongue. About age 9, they just don't have the ability to recover again. So I have to get in there a little bit, repair some damage. Then I can start on my way to airway and Myobrace and and correct the problem. So I'm using braces and expanders just to make room for the tongue and the palate.
Wow. Such a different perspective and kind of paradigm we're looking through with all of this compared to the traditional route there. I love it. So, tongue placement. Okay, this is something I've never heard of. Okay, I am a birth doula, and I've heard of it in the nursing world, and helping a mom get situated nursing. But outside of that, in childhood or in adulthood, I have never heard of such a concern as tongue placement. You briefly started to touch on this. Why why is this important and how can we help fix it?
Okay. The upper jaw doesn't have any genes to tell it how to grow and where to grow. There's not any genetic expression that tells the upper jaw how it should grow. The upper jaw is one bone of 28 in the skull, and it touches 80% of the other bones. So if your upper jaw, called the maxilla, is not the correct size and shape, it warps the whole face, and we get the whole face will become unsymmetric. Uh, so um, I've forgotten the question again. Hit me again with the question. I'm
No, you're
sorry.
fine.
Oh, the
So
tongue placement.
tongue
Tongue placement. Okay.
placement and how
So,
and why is it important?
all right. So it's up to the tongue to make the upper jaw grow. So if you put the tongue where it belongs, the very tip of it should be on a little button behind your two front teeth called the incisive papilla. We call it the spot. If I keep my tongue there, it'll make my jaw grow forward toward and give myself big lip structures um, and room to grow forward. If I keep the body of my tongue in the rest of my upper jaw, it grows my jaw laterally. And so the tongue and the upper jaw should be the same shape and size. And as the tongue is up there, you got to remember that the most skinniest part of our airway is the back of the tongue and the three walls of the pharynx. So if the tongue is up in the roof of the mouth where it belongs, it makes the upper jaw, it makes the airway bigger. And if the tongue is up there and it's exercising by chewing properly, breathing properly, swallowing properly, the tongue is very stiff and the airway is less collapsible. So if I can get the tongue up in the roof of the mouth, then growth will continue as it's supposed to. Eruption of teeth will continue as it's supposed to. Airway is larger and less collapsible. So this is what I'm looking for by getting the tongue up there. If I don't have the tongue up there, for whatever reason, because it was a learned thing with baby bottles, pacifiers, or if it's a tethered oral tissue like a tongue tie, then I will see uh, Christian Galimino, big researcher on sleep apnea, said that everyone with a tongue tie will have a malocclusion. And
Mm.
so it goes to it. You need the tongue up in the roof of the mouth. That's what makes people grow. I like to take credit for it, but it's really just Mother Nature taking over. Uh, but you just got to get that tongue up in the palate. Otherwise, you're going to have issues for the rest of your life.
And when you say swallowing correctly, that's basically getting the tongue in the right place so that one can swallow, and as they swallow, put pressure in those appropriate places.
Uh-huh. Yeah. So a correct swallow is done with only the tongue muscle, no lips, no chin, no cheeks. So if you put your finger on your front teeth and you swallow, and you feel any pressure,
We're
any
all doing it,
sucking,
you know it. We're all doing
yeah,
it.
yeah. So if you can feel yourself when you swallow, if you feel any suction on your front teeth, that is a bad swallow. You're using your lips, you're using your chin muscle, you're using your cheek muscles. And those are all muscles of facial expression. They're not made for swallowing. So that when you swallow, you should be able to put your finger on your front teeth and swallow without making any suction on the tip of your finger. So the tongue should be doing all the work itself.
And that's a test to make sure that you're swallowing correctly.
Uh-huh. Yeah. Well, you can just look at the teeth and see where the teeth are. I mean, I can and tell if they're swallowing correctly or incorrectly. But if you're at home, all you have to do is put your finger on your front teeth and try to swallow. If you suck on your finger, you got a bad swallow. If you don't suck on your finger, you're in pretty good shape. The other thing is just look, we swallow about every 30 seconds. So if you watch your child when they're watching TV or they don't know you're watching them, and you watch them swallow, if you see a grimace, you see any activity, what they call perioral, anything around the lips, cheeks, chin, every time they swallow, this is a bad swallow. They should be able to swallow with just the tongue muscle, which should be under the chin. So if you look under the chin and they use that muscle to swallow with, you're good. If they're using lips, chin, cheeks, then they're bad. Called an infantile swallow or a reverse swallow.
Okay. So I'm sure people are wondering, okay, so they still haven't put together the concept of how does Myobrace, like what is Myobrace? What do you guys use as your tool or your mechanism to fix this? And so then what does that look like? Like how is it fixing it in their mouth?
Okay. Myobrace is just a little silicone piece of rubbery looking stuff that goes in. And when you wear it, it lifts your tongue up in the proper place. It has little areas that will turn off the bad muscles and turn on the good muscles. Uh, and so it's doing it in your subconscious. So while you're watching TV, while you're doing your homework, while you're on Xbox, you're actually, your brain's somewhere else, but your subconscious brain is learning to swallow correctly. Now,
Mm,
Myobraces also has an oral myofunctional therapy component in that it uses Buteyko breathing and oral myofunctional therapy, which gets into their conscious brain. But the thing about Myobrace is you can wear it and get it into your subconscious brain faster. You don't think I've got to swallow now. Here I go. I'm going to use this muscle. So it's good to get it to have both, where you consciously learn how to swallow and you subconsciously uh, back that up through the Myobrace. So Myobraces, there's quite a few now. Some are for exercising. Some people have very, very weak lips. If you see somebody that their lips aren't together, and then you put their lips together and their chin muscle looks like a golf ball, it's really tight, those are very incompetent lips. They can't keep their lips together. So there's another Myobrace that is for lip strength. There's another Myobrace for tongue strength. There's another Myobrace for pharynx strength so that we can exercise the airway. Uh, but Myobrace is pretty much a system to get somebody to swallow the correct way and get them to breathe the correct way. And wherever their weakest point is there's something to use to help them get along the way and get over the hard part. Some people can just put a single Myobrace in and they learn it and it's fat and they're on their way. Some people need to be untied by their tongue. Some people, if you have incompetent lips, like I was just telling you, it takes almost a full year to get those lips to be competent so that they come together and not have the chin button muscle, the mentalis muscle fire. So uh, it's yeah, that's it, so my brace is a program that's, I'm going to say, we've got some things for newborns, but pretty much we have to be about age 3.5 on up because we have to have some compliance for most of our stuff to work.
mm. It's so interesting because I mean, I can't believe I made it to 40 years old and didn't know any of this. So we definitely need to get the word out. And I love anything that we're getting to the root of the issue. I don't believe in band-aids. I feel like we need to get to the root of the issue. Otherwise, we're just asking for, more problems in life, or just an unsettled state of, disturbances throughout life, depending on what the situation is. But the fact that your face has so much to do, and your lips and everything has so much to do with your internal mouth structure, is just fascinating to me. And I did want to say that I love the aspect that, you might not have to have braces. My kids were just getting started on this route, and my daughter is we're looking at maybe 3-4 months right now of braces, and then going to move into the Myobrace. And she's got a friend that, is going to have braces on for many years. And it's just mind blowing to me to learn this now and realize, wow, like, you know, and I had braces, we're not fixing the root of the problem. So I'm just so happy and excited to, be able to talk about this. So now let's dive into the health side of things.
Okay.
How does the structure of our mouth play a role in three things? And if I'm missing any, let me know. But our health, our breathing, and our posture. So maybe we'll
Okay.
take it one at a time. Like your health, like if we're not, I mean, and then I feel like kind of a trickling effect, because as I've learned, your mouth structure correlates with your breathing, and then your breathing correlates with your sleep, and then your sleep correlates with your health. So I don't know where you want to
Yeah.
start in all this.
Yeah. Let's start with posture.
Okay.
Uh, if your tongue is in the roof of your mouth, you will find, and you're breathing through your nose, you'll find that people have their shoulders will be even, their head will be up. But if your tongue is low, a couple things happen. One, you have to change your posture, just like CPR. You have to do a head tilt, chin lift to make an airway. So people with bad tongue placement or low tongue placement, you're going to see one shoulder higher than the other. You see kind of a head forward posture. They'll have one foot pronated because they'll be off balance, and you'll see several other issues with that. So they'll start to have scoliosis of the spine right away because they need that to be able to breathe.
Okay, wait, can we
So,
stop right there?
okay.
Because that blew my mind when you and I spoke the first time. I hope you all just heard that scoliosis can start due to your poor mouth structure. I mean, that's crazy to me. Okay, keep going.
Okay. Um, let's let's take another fact. So that's kind of some posture issues. Um, Now, if you want to talk about sleep, sleep is the most incredible thing, and more research is coming out on sleep. So there is sleep apnea, which is mostly an adult thing, and there's sleep disordered breathing, which is an adult thing, but it's also a kid's thing. And with sleep disordered breathing with kids, it's defined as having your mouth open more than 10% of the night when you breathe. And when we start to look at sleep disordered breathing, we see that it really hurts us in school. I mean, our aptitude scores are much lower in our mouth breathers. Mouth breathers are more likely to be in the bottom 50% of our class, or bottom 25% of our class, and people that have sleep apnea are in the bottom 10% of our class. Uh, the need for they're also going to show a need um, uh, for uh, for tutors, and they're just not able to do it to do the to do that type uh, of recall of intellect. On top of that, they're going to be not as they can't perform as well on the athletic field. Um, when you're not in your deep sleep, you're not getting muscle repair, nerve repair. Short-term memory doesn't go into long-term memory, uh, so it's hurting you quite a bit if you're not getting deep sleep. And you're only going to get deep sleep when you're breathing through your nose and not through your mouth. So that's sleep is a very, very big deal. and it's
Well,
really
and didn't you
driving.
also mention it could cause almost like ADD type symptoms?
Oh, yeah. What they found, there's a white paper that's been done out of Australia, and he's an orthodontist. And you don't have to have a polysomnogram or sleep study uh, on a kid to tell them that they have sleep apnea or they have sleep disordered breathing, but he did it anyway. So he found that uh, of the kids that were sent to him that were already started on Adderall, Ritalin, the stimulants, they also had sleep apnea. And when they treated the sleep apnea, the need for the stimulants went away. So, yes, so what we're finding is that ADD, ADHD is more of a sleep issue rather than is anything else, which makes sense because how come you take an overstimulated person, give them a stimulant, and that makes them behave better? So, our theory is that when you're not getting good sleep, you wake up tired, the adrenal glands just pump tons of adrenaline into you rather than drip it throughout the day, and you're overstimulated throughout the day, and then you crash. So, so yes, ADD, ADHD need to be looked at as more of a sleep issue first before you put them on any type of stimulant. Uh, we're going back to something you said earlier. You said it was kind of funny that we don't know things about this type of material. And it's really funny. The veterinarians know this because they have breeds of dogs that are bred to have short snouts, that have sleep apnea, that have these other issues. Uh, so they know the stuff, but our pediatricians don't. Uh, so it's kind of funny that we know more about dog stuff than we know about our kids sometimes.
That's unfortunate. And I just can't get over how unsuspecting it is that, here someone can struggle with these various health ailments, some of which you just mentioned, and it's due to poor sleep, but then it's ultimately due or links back to their mouth.
Right.
I just can't tell you how I never had any clue about any of this.
Well, if you look at it, we had up until 250 years ago, we had room for our wisdom teeth. So that meant that our faces were growing more farther forward, and our wisdom teeth would come in about the age of 18. Nowadays, we have no room for our wisdom teeth, which tells us our faces are growing less forward. Uh, and with that, that brings the airway, the tongue back, and the whole airway issue into play because we're losing maybe 10 or 12 millimeters of growth forward. And to have a good airway, you needed about 10 or 12 millimeters. So we're losing our jaw structure. Anytime you take something with Mother Nature and you play with it, you're going to get a recourse, and that's kind of think what's happened with changes in our food, our diet, our feeding of our infants. If you do something like that, it's there's going to be a recourse, and this is what it is.
And I know one of the symptoms you had asked us about, or I know one of the questions you had asked us about was, if my kids ever had swollen tonsils, that kind of thing. I found that interesting. And then I remember you telling my son that he would, if he had his Myobrace in, I think you said he would be able to lift more weight. Like he's been trying
Yes.
to work out a little bit more and he'd be able to lift more weight. Explain that.
Okay. Couple things with the tonsils. When we breathe through our nose, 80% of what we're allergic to is filtered. The air is humidified and warmed. So when we breathe through our nose, our lungs are getting humidified, warm, filtered air. When we breathe through our mouth, all that nasty stuff goes right down into our lungs. And our tonsils get big and infected trying to do the job of the nose. So a lot of times we get them on Myobrace. If they start off well, first of all, if their tonsils are really large, they can't do Myobrace because they can't accept it. So we have to get the tonsils out before we get going. But for the most part, if we can get them nasal breathing and not mouth breathing, tonsils will shrink on their own and avoid tonsillectomy. Now, let's go back to what you were saying. If I took my hands and I grabbed your neck and I applied a pressure so that you couldn't breathe very well, so I was starting to strangle you, There's two nervous systems, the parasympathetic nervous system, which is our chill out mechanism, or sympathetic nervous system, which is our run away and hide or fight mechanism. If I was choking you, which nervous system do you think would be dominant?
The sympathetic.
Exactly. And so for people that are have the low tongues, they're sympathetic dominant all the time. And that's not good for us at all. We need to be parasympathetic dominant so we can heal and chill out. But when our airway is being compromised 24/7, we have to stay in kind of a sympathetic mode. So what I do to test this is when people come into my office, I move their jaw forward. It's called a MORA, or mandibular orthopedic repositioning effect. And anyway, so I put their jaw forward where it really should be. Then I have them kind of stomp around a little bit, and I can see their posture get better, and I can see uh, kind of light in their eyes kind of shows up. And then I know that what I've done is I've turned on the parasympathetic nervous system. And we found that with that, if you try to lift weights in sympathetic dominant mode or parasympathetic dominant mode, you're about 25% heavier weights in parasympathetic dominant mode, because your body is able to send uh, energy or blood or oxygen where it needs to go to apply to the problem that you're putting it through. But when your airway is challenged, your airway always number one. So if my airway is bad, I'm going to dam my posture. If my airway is damned, then I'm going to do whatever I need to do to get my airway right, and then try to take on the task at hand. And I can't do it as well.
Wow. And that's a whole other aspect of immune health that we certainly don't think of.
Oh, yes.
Ugh. So good. What we've talked a lot about children. There might be some adults out there that are thinking, well, is Myobrace for adults? Fill us in on that.
Okay. With adults, we have to look at their upper jaw and see if they have room for their tongue to go up there. Uh, with adults, we're looking at three things. We're looking at the malocclusion, we're looking at sleep, and we're also looking at TMJ, the joint back here. And I go back to that muscle, the chin button muscle that I told you about, that tries to pull the lips apart. That's the muscle that really causes TMJ, because every time I swallow with this muscle, which is 1,800 times a day, just like getting socked in the jaw, and the TMJ joint is the uh, is where it all collects, or it's the like when you're in a car and you have the wheels shock absorbers. That's what I'm trying to say. So this joint's kind of like a shock absorber. So if we're wearing it out 1,800 times a day, like getting socked in the jaw 1,800 times a day, that's what starts TMJ. So that's one thing for the adults that we're treating. Two, we're looking at sleep apnea. And for sleep apnea, what we do is we use the Myobrace to try to get, again, to the cause of sleep apnea. A couple things we found. People who played the didgeridoo, which is a wind instrument in Australia, they hardly ever have sleep apnea. So people started playing the didgeridoo and lowered their sleep apnea scores. We found that people who played the double reed instruments in an orchestra were less likely to have sleep apnea. We found that people who practice oral myofunctional therapy and Buteyko breathing were less likely to have sleep apnea. So we found that we can get rid of sleep apnea through exercise, which makes total sense. So again, we go back to where sleep apnea occurs. It occurs in a chamber that has three walls of our throat and one wall of the back of our tongue. So if we can make our airway bigger by moving our tongue up there and exercise our throat and exercise our tongue, making our airway bigger, less collapsible, and therefore less sleep apnea. Now, for adults that want to straighten their teeth, then we have to make sure that we can get the tongue up there. If the tongue can't get up there, then I have to do some type of expansion appliance for a little while to make sure the tongue can get up there. Then it's just like anything else. We're just teaching the tongue to get up there. And as we do that, eventually the teeth will start to look better. To move a front tooth, it takes about 2 grams of force. To move a back tooth, it takes 5 grams of force. Every time we swallow, our tongue puts about 300 grams of force and our lips put about 500 grams of force. So if our tongue and our lips start working the way they're supposed to, the teeth will move along the way a little bit on their own. Now, it won't get perfect Vogue model perfect like braces can do, but it can get everything a lot more sturdy. It will cut the decline because people's smiles are always getting a little bit worse, a little bit worse, a little bit worse. As they get older, if they take a picture of when they're 18 and when they're 35, they can see that their teeth are collapsing. And this will
Hmm.
stop that and kind of reverse it a little bit and actually get it to the point where they can improve not only their health, but also their smile. There's a big thing going in through Europe right now. There's a Professor Mew, MEW, and he's been a big proponent for this. He's about 92 years old, and his son Mike is an orthodontist too. So there's something called mewing, MEWING, where people in Europe are just forcing their tongue up in the roof of their mouth, and they're taking pictures from the side and from the front, and they're showing this change all on their own. Uh, so mewing is kind of like what we're doing. Uh, it's kind of by forcing your tongue up there all the time. It's like what the Myobrace would do. So,
Hmm.
so it's interesting. So you can go on and look
So
at
interesting.
mewing, and you can see. Uh, there's also a lot of asymmetry. This is kind of weird. If you go back to your maxilla, your upper jaw, if it's not shaped like it's supposed to, and you look and you see a very high vault to your palate, you'll also find that your eye sockets are in different shapes and sizes. So if you ever wondered why you could have
Wow.
20/20 vision in one and 20/40 in the other, it's because they're not the same shape and size
Oh
in
my
your eye, in
gosh.
your orbits. Um, we were also finding
This
all
is so
kinds of weird
much
stuff.
deeper than what you ever thought.
Yes. When we look at panic attacks, uh, we find that they're pretty much a breathing issue as well. So treating asthma is a very easy thing to treat. Look up Buteyko breathing, and you can treat asthma almost over the counter on your own, but just by doing Buteyko breathing if you want to treat asthma. Um, Other things like bedwetting, uh, you know, there's a lot of the deeper you
You've
get into
listed a
this,
lot of things right there.
yeah,
Things I hadn't even
uh,
heard of yet.
yeah. What it is comes down to as we're breathing, if we breathe through our mouth, we're losing too much carbon dioxide. And carbon dioxide, it has four major functions, but its most major function is that it makes smooth muscle relax. Well, where's our smooth muscle? Well, it's in our lungs. And if our lungs won't, if they won't relax and they're always in tetanus or always in syncope, then we can't fill our lungs full. If it's in our bladder, if we're losing too much carbon dioxide, our bladder will go into uh, to tetany or
Spasms?
into spasms and will urinate at night. Hypertension, all of our blood vessels are lined with smooth muscle. And if we don't have enough carbon dioxide in our body, then we're more likely to have hypertension. So this spreads throughout the entire body, and we can start seeing a lot of problems. Now, it's not the one thing that's going to cure everything, but it's one of the dominoes in a lot of things that can make things a lot better.
I am beside myself over here. I cannot. I don't think I've been so speechless in a podcast. I'm just like, wow. Okay, so as we wrap this up, what are some top three tips? Or no, I should say, what are some like top three signals, signs or signals for our listeners that they need to be aware of with their child? Signals that might point to the need that my child might need Myobrace. And I was talking to a friend, and I was telling her, how her son could probably benefit from this. And she was like, "Well, my son has great straight teeth." And I said, "I know." I said, "I thought my son did as well. But come to find out, when you guys checked him at the office, you said he only had 40% of his airway where he was getting air through. And that's horrible." So, for someone that's looking at a holistic approach to health, or helping their body be able to function more optimally, my goodness, this is certainly needs to be a priority in life for all of our kids and our toddlers. And even if you're an adult, I mean, go back and get this addressed. But what are some of those signs and signals that moms or just women can be aware of?
All right. Well, the number one thing is go in and look at your child at night while they're sleeping. And if they have their mouth open and the breath is through their mouth more than 10% of the night, it'll either be between 50 and 100% of the night, uh, then you need to, they definitely have sleep disordered breathing. If you look up sleep disordered breathing, that's nothing that you want for your kids. So the easiest thing is just go in and take a picture of them or video them at night and see how many times at night you go in and they have their mouth open. Start to look at your kids from the front and the side and see what their posture looks like. If they have their head forward, if they have one shoulder higher than the other, uh, this is another thing that you need to get on. 3, watch their swallow. If they swallow incorrectly using the wrong muscles, which you described earlier in the podcast, that's a good key to get them in as well. So, sleeping is probably the most important thing, and it's the easiest thing. So, I would just say go in and watch them sleep. And, if you have to, you can take a little mirror and just see if the air is coming out of their nose or out of their mouth when they breathe. And if it's coming out of the mouth more than 10% of the night, you need to have them looked at. The problem comes in who should look at them, because there's not many people that understand this. But pediatricians are now getting a little bit worried about sleep. And if you mention sleep, or if you're a big pusher of sleep, then that fires off in their head. Shoot, I don't want them to, have sleep issues, and I'm not on top of it. It scares them enough into looking into it. But they don't have anything in their armamentarium to treat it. They just don't have anything. They have, what are they going to do? To do a polysomnogram and put you on a CPAP? If they put you on a CPAP, it's kind of like what we used to use as a headgear, and it you put the CPAP on, it won't let your upper jaw grow. You're just making the problem worse. So uh,
What about
when you talk,
adults on a CPAP? Are you able to
same
get them
problem.
off?
Well, kind of a CPAP. It's hard for me to say. Well, CPAP is always making the airway worse. And so that's why you have to, on the CPAP, you're always having to turn it up a little bit more, as you get older, because it's pushing the upper jaw backwards with time. But it saves their life in the meantime. Uh, so what we do with the people with CPAP is we have them start exercising, kind of like the didgeridoo or a double reed instrument, but we have Myobrace that do the exact same thing. We start exercising them, then we have them start putting the Myobrace in underneath their CPAP. And a lot of them have very smart CPAPs. You can start to see the amount of pressure that they have to put in the CPAP decrease. And they can do a split study after a while. Split study, have them sleep half the night with a CPAP, and then half the night with a Myobrace, and see how they're doing. But that takes about 6 to 9 months to get that done.
Mm-hmm.
Um, so 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 again,
Wow.
that's adults. You can see this is it's like a long tentacles that kind of go anywhere and everywhere. I know people that listen to this podcast say this is silly. It's got its little hand in everything, but it does. It's not the main culprit in a lot of things, but it what it does is it affects a lot of different things in our body.
Oh, you're telling me. I have been just so looking forward to today and being able to share this and continue to learn more myself, because I feel this is so important and something that we are greatly lacking in society is the knowledge of this. And doctors, I don't even think are aware of, we're giving out medications for things that we need to go see a a myobrace
Yeah.
or a myofunctional therapist for, so we
Yep.
gosh, it's just, that's where it comes back down to, it's all about knowing better so you can do better. So,
Yep.
well, Dr. Norton, where can people find, what's the best advice of where someone can find a Myobrace facility? And in case anyone is wondering, where can they find you?
Okay. For Myobrace, I would go on myoresearch.com or myobrace.com. And on that, there's tons and tons of information that you can do to educate yourself over what we've gone on for the last 30, 40 minutes on this podcast. Uh, but you can educate yourself on there. There's a place where you can find a provider. And I would, that's where you can find the provider closest to you. Uh, for me, I've got about 155 days before I retire out of my West Texas digs. So I'm in like, I'm in 6 cities in West Texas. And then I'm going to
Wow.
retire in about 55 days from there. And I'll just be in California at our Ontario office from then on out.
Well, we are so excited and blessed to have you. Let me just say, I feel so special to have you fly all the way from Texas.
Well, it just tells you that the state that we're in, trying to find a provider to do something like this, we have to fly somebody from Texas to California to be able to do it. Why aren't there tons of people in California that could do this? Why does it require somebody to fly out there? That just tells you there's not a, I think the younger dentists are getting it, especially the young female dentists are getting it. Some of the young female ENTs are getting it and understanding it. So I think we're getting better. There's one more thing that, I told you Myobrace is good for about the age of 3.5 on when we get the age of compliance. There's another kind of industry starting from about the age of 0 to 3.5. I think you had Dr. Nora on your program earlier, and
Yes.
she is kind of leading. She and the Breathe Institute, which is again another California care center, are kind of leading that charge from the ages 0 to 4. Because until then, I didn't have much I could do for somebody that's like 2.5. I mean, I've got a little
Hmm.
Myobrace play thing that helps a little bit, but until they can consent and give me compliance, I'm really have my hands tied. So there's kind of two places you can go for this. If they're between 0 and 3.5, then you're probably better off seeking somebody like the Breathe Institute. But if they're 3.5 and older, then they would probably follow our courses in Myobrace until it's time to have your tongue untied. If your tongue's tied down, then you'd probably go to the Breathe Institute and then come back to Myobrace. Uh,
Hmm.
so, so if I think your podcasts are covering the broad range of possibilities for parents to do for their kids uh, on this. And if you want to pick another area sometime and just say asthma or something
Hmm.
else, we can go down one of the little tentacles and explain better of what this does.
Oh, I
But
would love that. Love that for sure. We'll definitely have to have you back. And I'm so glad you brought up Dr. Nora because we did have her on and it was incredible. I am so excited to get the word out about, the fact that there is holistic pediatric dentistry that is conservative and really looking at the health of the child and then all the, breathing, and she's familiar with the myofunctional therapies. I mean, it's just incredible. I know you all work together and so if you haven't listened to that episode with Dr. Nora, make sure to jump on over there after this because these two podcast episodes will go great together. Well, Dr. Norton, thank you so much for being here.
it was a pleasure.
I know you just got done with some knee surgery, I think you said. So I appreciate you hanging out with us and chatting with us as you're on recovery and just appreciate your wisdom. I am so thrilled that you have been one of the people to learn this therapy and be able to help so many families starting at the root of the issue. And I hope that many people follow suit, that we can get the word out so we can get more therapists around because like you said, there's just not enough.
No, there's not. It's been very fun concentrating on this for 45 minutes rather than my knee. So this has been great.
I love it. Great. Well, thank y'all for being here. We'll see y'all next week, same time, same place. Bye for now.